It is important to do your best to follow these safety precautions to help prevent infection while you have a Foley catheter. Always wash your hands before and after touching the catheter or bag. If someone else is caring for you, they should also wash their hands. Clean the insertion site and catheter area with soap and warm water at least twice a day. You can take a shower with it daily to keep it clean. Clean the catheter and insertion site after every bowel movement and always wipe away from the insertion site. Empty your bag regularly when it is 1/3 to 1/2 full, before you leave the house and at bedtime. If it gets too full, urine can flow back into the bladder and can cause infection. Never let the drainage spout touch anything, including the toilet. If it does, clean it with an alcohol wipe. Always keep your drainage bag below the level of your bladder to keep urine from flowing back into your bladder to reduce the risk of bladder infection. Always try to keep your bag in the upright position, hanging next to you. Look at the urinary bag's tubing throughout the day to make sure there are no kinks or loops that prevent drainage into the bag. And when laying down, make sure you're not laying on the catheter or blocking the urine flow. Wear loose clothing that doesn't rub or pull on your catheter. When wearing the leg bag, make sure the catheter is secured on the leg below the bladder. When securing it, keep enough length of tubing between the insertion site and the stat lock. Talk to your healthcare team about how much fluid you should be drinking. Drinking plenty of water helps keep your urine flowing, and your urine should be light yellow or colorless. If you notice any of these signs of infection or complications, call your healthcare provider. Fever, chills, or sweats. New confusion. Abdominal, pelvic, leg, or back pain, swelling, redness, warmth, or discharge at the catheter insertion site. Burning in the urinary tract. Nausea, vomiting, and/or unable to eat. Blood clots that look like red or dark brown clumps in urine. Red, not pink urine for more than 2 days. Large red or brown particles in your urine. Urine leaking around the insertion site. Urge to urinate. Bladder spasms that feel like a strong, uncontrollable urge to urinate for more than 2 days. Little or no urine even after drinking fluids. If the catheter stops draining, please contact your provider if you have any questions or concerns. Here are a few frequently asked questions from patients living with an indwelling Foley catheter. Can I drive with an indwelling Foley catheter? It is important to talk to your provider about driving. For safety reasons, they may provide you with a leg bag. Can I bathe, swim, or have sex with an indwelling Foley urinary catheter? Please talk to your provider. What if I have pets? Make sure the pets are not playing with or sitting on top of any part of the Foley catheter system, including the tubing. What do I do with the urinary bag while sleeping? Make sure to clip the green clip to a fitted sheet. Keep the bag below your bladder to avoid urine going back into the bladder, which can cause a bladder infection. Keep the bag upright and never lay it flat on any surface. For example, you can hang the bag on the bed frame with a hanger or next to you on the bottom of the chair. What do I do if I touch the end of the drainage tube? Wipe it with an alcohol wipe. How can I keep others from seeing my urine? How can I keep my urine bag private? Smaller leg bags can be worn under your clothing. Larger urinary bags can be covered by using a urine catheter bag cover. There are many different types of catheter bag covers that are easy to order online. Remember to keep the covered Foley bag lower than your bladder to reduce the chance of a bladder infection.